Welcome to our today's health talk. And in our today's presentation, I want us to have a look at a condition referred to as epistaxis. And let's move into it very quickly. What is epistaxis? So by definition, epistaxis simply means nosebleeding. Or if you like, this refers to bleeding from the minor blood vessels that are found within the nose or within the nostril. So simply bleeding from the nose is called nosebleeding, and the medical terminology for that is called epistaxis. Now there are two types of epistaxis or two types of nosebleeding. The first one is called anterior nosebleeding or anterior epistaxis. The second type is called the posterior epistaxis. Anterior epistaxis simply means that nosebleeding which originates from the frontal part of the nose. The posterior epistaxis refers to the nosebleeding that originates from the back part of the nose. Now, there are several causes of nosebleeding, and I want us to take note of the following before we get into it deeply. Now, nosebleeding is common among children aged between 2 years to 10 years old. And again, it's also common in older adults aged between 50 to 80 years of age. It is scientifically backed up that as one grows older, the possibility of blood clotting is then reduced. Now let's have a look at the causes of nosebleeding. And also take note that this list is not conclusive, for there are so many causes of nosebleeding. For our today's presentation, we'll just be able to then look at just a few of the common causes. The first cause of epistaxis is called the upper respiratory tract infections, for example, as seen in sinusitis or even coryza. The next cause of nosebleeding is referred to as blowing of the nose by force or by using a lot of force. The next cause of nosebleeding is trauma, and this can be either direct trauma on the nose or facial trauma, as seen in cases of accidents. The next cause of nosebleeding is allergic reactions, as seen in allergic rhinitis. The next cause of nosebleeding is called the drugs, and under drugs there are two categories. The first one is called the non-medicinal drugs, as seen in cocaine inhalation. The next one is medicinal drugs, and under medicinal drugs we have the blood-thinning drugs or the anticoagulant drugs, for example, warfarin or even heparin. We also have antiplatelets, for example, the aspirin. The next cause of epistaxis or nosebleeding are chemicals or sprays from chemicals. And this is also very common. Various chemical irritants can irritate the nose to an extent that then the net effect is nosebleeding. The next cause of nosebleeding is deviation of the septum. Septum is the membrane or the cartilage that do separate the two nostrils. If it is deviated, then chances of one developing nosebleeding is very high. The next cause of nosebleeding is referred to as high altitude. Scientifically, the higher one goes, the drier and the thinner the air becomes, and that increases the chances of nosebleeding. The next cause of nosebleeding is alcohol abuse or heavy intake of alcohol. And the next cause of nosebleeding is referred to as various blood disorders, And these are also several. For example, hemophilia. Number 2, we can have leukemia or even the von Willebrand disease, among others. The next cause of nosebleeding is referred to as the atherosclerosis, and atherosclerosis simply means fat depositions on the blood vessels. And this is more common among the obese patients. The next cause of epistaxis is called facial or nasal surgeries. The next cause of nosebleeding is nasal growths or even the nasal polyps. These are growths that are found within the nasal cavity. The next cause of nosebleeding is referred to as the immune thrombocytopenia. And the last but not least is referred to as pregnancy. So then, ladies and gentlemen, as you can see, there are a variety of causes of nosebleeding. And therefore, should you suffer nosebleeding, or should you come across patients or one of an individual suffering nosebleeding, then kindly make quick referral to the nearby health facility for quick intervention. As you may assume, but it's only through medical intervention that one can then be able to ascertain or confirm the exact cause of the nosebleeding. And once the exact cause is identified and addressed, that is when the problem will be solved. If you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.